everyone. Welcome back to another episode. Today, I have Lisa Carlamuso with me chatting about everything dental care. She is the owner of Dental Hygiene of Niagara and a registered hygienist. And today I thought I talk about a lot of health, physical body, and I really want to cover all the aspects of health. And I feel like dental care kind of gets lost in the shuffle. And I really want Lisa to chat with me today to really highlight the importance of cleaning your teeth and just getting regular checkups. So I want to give you a backdrop. I mean, I grew up with all the dental care. I was very blessed as a child growing up in a household without benefits. So when I think dental care, I think of, all the braces, the headgears, the mouth guards, getting my teeth cleaned. But I'm not going to lie, I never loved going to the dentist or getting my teeth cleaned until I went to Lisa's office, okay? I gotta say, it is a beautiful office. It's modern, it's sophisticated. Lisa really knows what she's doing and her team when it comes to making you feel comfortable because, again, someone's working in your mouth and it can be kind of weird, but going there, you never feel like, I don't know what to say. I don't want to open my mouth. She makes her and her team make you feel comfortable. It's a great office. It's located in Niagara. And Lisa's going to give us the deets on everything we need to know about dental care. So welcome, Lisa.
Thanks for having me, Michelle.
It's a pleasure. Before we get into the questions that I have for you, tell us a bit about yourself.
Well, I'm born and raised in St. Catharines. I'm married with one child, although it feels like four. I am obsessed with all things dental. I don't know why, just who I am. I live across the street from my mom, just keeping it, everyone loves Raymond. What else? I don't know. I'm not that exciting.
You are. That's awesome.
That's basically my life. I just work, come home. My mom's across the street. It's just super Italian over here.
I love it. That's what makes you so real and authentic. Okay, so tell me, when did you open up Dental Hygiene of Niagara and why?
So I opened the doors August 2014. It's kind of a convoluted way how it happened, but essentially after college, I had moved to Vancouver. At the time, I still wanted to be a dentist, and I was taking some courses, what have you. And then I was working there, and I got a really awesome job. Actually, the employer I had, he was amazing, and he loved dentistry so much. So any opportunity he had, he would show me Lisa, come look at this, or showed me so many things, and then it just kind of got me more involved. Instead of just cleaning the patient's teeth next, he really had a side of him that was really passionate about overall health and oral health and linkages. And that kind of how it started, because I started getting more interested. And then, so I was really involved in helping form a dental hygiene department in his office. So that's where I kind of started learning more about things that you would order, or the equipment and stuff like that. So I kind of became the lead in that role. So I developed an understanding for the equipment or how things work and stuff like that. And then when I moved back to Niagara, because my father was getting more sick, so I came home. So when I moved back to Niagara, I was working in a sedation office where I had to do my own insurance claims and get breakdowns for patients. So I started learning another aspect. So and then I was taking a couple courses, continuing education, and I would focus on self-initiation or independent practice. And at the time, I had no interest in being independent. It was just continuing education hours and let's learn it. So when I mixed all of these things that I had learned in Vancouver and what I was doing in Mississauga, I kind of realized that my passion for dentistry and my interests, we're at a weird point. We're starting to meet this innate quality that I had of entrepreneurship, I guess, would be the best way to describe it. I was always interested in business stuff, but coming from a family, we didn't have the type of businesses that are regulated like healthcare, right? It was more like bricks and mortar type businesses, like a restaurant, pizzeria, like stuff like that. So the entrepreneur side of me kind of met the professional side of Lisa. And then I was like, you know what, I could probably do this and then use all these skills I learned and then put my passion forward and kind of change the way we see dentistry right now.
I love
specifically dental hygiene.
I love it. I love that, it's kind of like, and anyone that meets you, I have to say, anyone that meets Lisa knows she is passionate about teeth, okay? She could talk teeth all day long, and that's what makes you feel comfortable, because when you go to her or her team, they all, feed off Lisa, is that they want to see your teeth. They want to get in there and clean your teeth. So it's not like they don't love their job. They love their job.
No, we call it treasure hunting. So it's like the more the merrier. It's like people are so embarrassed. Like, oh, I'm so embarrassed. Like my mouth's so dirty. I'm like, no, like you don't understand. Like obviously we want you to have a clean mouth. We want you to be healthy.
Yeah. But
we are not offended on any level. Like you come in with a lot of tartar and buildup in the mouth. Like I get my jollies are on. Like I'm like, yes. It's like the best way to describe it is if you like squeezing pimples. We love dental hygiene. Like when you see the stuff come out, it's so good.
It's gratifying. Oh my gosh, you're so funny. Now I've always wondered this, and you have helped me in the past, but you work closely with other dental offices, correct?
Mm-hmm. Yes.
So anyone that, I think there's a misconception because, if someone's going to your office and they have a dentist, like how does that work? How do you bridge that?
So there's different ways. We do have a part-time dentist, but right now he's not doing treatment. We should have been doing treatment by now, but COVID kind of changed my plans because I spent all my money I saved on COVID rentals, which I'm sure we'll get to. But essentially the way it works is, and it's really not that complicated. It's just because it's a new thing. And I think maybe I'm more used to it. So I don't think it's complicated, but essentially we're focusing on prevention, right? So traditionally, we're used to like dental cleaning, checkup, x-rays, and done. So when we're in school, dental hygienists are taught, so when we take x-rays, for example, you're taking them with a rationale. We don't take x-rays because of policy. Like, oh, our office takes them every 6 months or yearly. We take x-rays as needed. So we would do an intraoral assessment first and say, oh, you know what, Michelle? I'm really suspicious of this area. It feels sticky, or when I'm in there, it doesn't feel right. Or maybe you're presenting with like symptoms that are like, then you ask more questions, and then we would have a rationale to expose you for an x-ray, right? So in our case here, we would do our complete oral assessment, focus on assessment structure. So we do all of that, clean your teeth, and then interview basically, and we learn more. So even if you don't present with something specific that we can see like a cavity, there's so many more things that you'd be referred out for. Okay. So in that sense, if you have your own dentist, we would say, you know what, it's been a year. We really recommend that you see your dentist. So we would write up a referral for your dentist, and then we give you the option. Either you take the referral and call on your own time, as long as we did our due diligence. Like I don't care. I do care, but I don't care if you don't go. Yeah. As long as you're informed why you should go. We've done our job, but it's up to you ultimately to be responsible for your own health. Or if you don't trust yourself that you're going to call the dentist on your own, we can send the referral for you saying, RDH, which is registered dental hygienist, notice these areas, and through interview, like these are our concerns. Please, could you call the patient to book an exam and x-rays for a definitive diagnosis? Because the doctor is the only one that can diagnose. So that's why we would need the dentist. Okay. Otherwise, if people, or if they don't have a dentist, we help find them one. We don't refer just to a specific few. Okay. We can refer to anyone if you have someone in mind, or you can only do evenings. Well, that takes a bunch of dental offices off the list because we know who's open late, who's open weekends. Do you prefer a male dentist, a female dentist? Like based on how you present, based on past experiences, or we kind of can feel you and be like, yeah, this place works great or
Okay.
whatever.
That's good to know. That's good to know because I think people, they're not sure how that would work. And that's a perfect explanation. I mean, you work closely with all different types of dentists and it's about comprehensive healthcare, right? So
It
just
is.
getting it, you
And I'm
know.
sure there's some like dental offices that probably have been not as like didn't probably love what I was doing, like or starting because it is different. And truly an independent dental hygienist, you really do need to like eat and breathe dental because you need to be able to work as a partner in care with the dental office. It's no different. All the dental hygienists here have the same education as a dental hygienist working in a traditional dental office. In that regard, there is no difference. It's just we're just doing dental hygiene. Like
you have more time with the patient.
we're just allotting more time.
Awesome. Okay, so another question, and you know, I've wondered this before. Maybe you can highlight it. Do you ever, you know, when you're doing an assessment in the mouth, check for any abnormalities? Like, you know, there's throat cancers, there's ulcers in the mouth. Like, do you check for that?
Yeah, that's my jam. That's my area of interest. So like everyone has their area. You know, like somebody might like periodontal disease. Somebody else might be really into orthodontics. I love anatomy and physiology and abnormalities. So we always do an oral cancer screening. So there we're checking for like color. So we're looking at the tongue, the throat, anything like that. We're checking for abnormal lumps, discoloration, things that would be like abnormal. Malocclusion, which would be like your bite. So if we notice, like especially at a certain age group, that's like when you warrant a referral to the orthodontist, or you bring up the conversation with the parent or the adult, what have you. Gum disease, there's different structures that you're looking for or loss of structure. Face, neck, and mouth, basically, even freckles. Like sometimes people are like, oh, I've had that freckle there forever. So we call them macules. So if they're like in this area and, you know, I see something, I'll write it down, like, you know, especially if you don't have a lot of them. And then if you come back in like a year, let's say, or 6 months, and we're like I start to remember people's faces and a lot of healthcare practitioners do, you start to memorize the person, right? And you'll look for that. Like if the border isn't the way it should look or the coloring and stuff like that. So I would say like on the top of the mind, oral cancer is huge because it can drastically affect your quality of life very quickly. Because I think we take for granted our tongues and our teeth. And if you lose a piece of your tongue, like all of a sudden now you can't speak properly, you can't eat properly, you can't chew properly. And I think what we don't realize is our teeth, like we don't want to lose them because the mouth is the beginning of the digestion of food. So now that it's great that the world is starting to talk more about gut health, which is super important. But if you don't have all of your teeth, like our front teeth are for tearing food. Then, you know, chew goes to the premolars. It's starting to masticate. By the time our food gets to the molars, that's our chewing teeth. That's what's ripping up the food. And then our tongue helps create a bolus, right? So that with saliva it mixes and then we swallow. Okay. If we don't have molars, we're not chewing properly. So our food, now our digestive system has to work harder to like break it apart. By the time it gets to our intestines, it's a disaster. We have blockages, oral cancer gets on like there is so many linkages with oral health. And so oral diseases, even like decay in the mouth, so important. Oral cancer is so important. And even things like, we'll notice like when you get to know someone now with these N95s, you can't really smell much, but sweet breath, for example, if you notice that you have a really sweet breath, it could be a sign of diabetes. Wow. Right? So 90% of people with diabetes are type 2, 10% are type 1. So there's things like that. Or if you even like it smells like nail polish remover. If you ever have like a nail polish remover kind of smell, that's from acidity and that can be diabetes. Or like sour breath could be GERD, like a gastroesophageal disorder. So like you have a reflux where you get like acid reflux all the time, and that acidity creates an acidic environment, which not only could it be GERD, or you could find out that you don't, the flap that that might not be working, or it could be an eating disorder. Like those things too, like I'm so sensitive with the eating disorders because there's so many people out there your dental hygienist most likely will ask you at some point, like, do you have a lot of acidic drinks? Like, because the back of the teeth, when the vomit comes up, it erodes the enamel. So the first question is, we're not going to be like, do you have bulimia? Like, it's an interview, right? Like, do you consume a lot of lemon water, acidic drinks, or like, there's so many questions. And sometimes you're lucky enough to get to the root of it. And you're like, okay, that's fine. Instead of being like, don't do that, we need to talk about what can we do that's going to help you. Like, we can't fix that problem today, and nor is that going to be my area, but we could give you tips on how to reduce the acidity in the meantime of that pathway. So there's so many.
And that's why I think it is so important. We talk about breast examination, and we talk about getting things checked, prostate, breast examination, going for blood work. But I honestly believe, and I feel that the oral health gets missed. And just how you're speaking about, like, this is the beginning of a lot of internal disruption that could happen. So, and I know we shared last time I was in, I always was asked, right? And I've shared my story with eating disorder. I've always was asked, what you just said, do you consume a lot of acidic drinks? And I'd be like, no. Do you do this? No. But I've always had acid reflux, and it goes hand in hand. And I share with you, and you did say, well, that makes sense in your teeth, And I just think it's important because people get so embarrassed, like the smell. But it's one of those things where you're a professional, and if even if someone came to me for weight loss, I wouldn't be like, well, too late. You work with your patient, and that's what I love about going to you is that I can tell that you're very authentic, and even your staff. So it's easy to open up, and I think people need to know that if you don't have that relationship with your dental hygienist, it may be time to explore different options, because I was there before where I would miss appointments, and I didn't want to go, and I didn't have that connection. I would never share what I shared with you with anyone else because I wasn't comfortable. It's a comfort level in order for
that's like music to my ears. That's like my goal here. Yes. I want people, dental hygiene or dental in general, right? But dental hygiene, the hygienist does spend more time with the patient than the dentist's treatment, like examination. And the hygienist kind of builds that rapport because you're with the person for like an hour. That is where in healthcare in general, not just dental, it's like we need to spend more time with people when it comes to healthcare, because that's how you find out about someone. So, we start the appointment, like, any changes to your health history, like medication, allergy, surgery, fever, no, okay, great, let's move on. But it's like in conversation, the person's like so stressed out, like, oh, I've been sleeping 3 hours a night. Like, I got a new puppy and they're peeing all night. And that's important because right now, as you're telling me that you just got this new puppy and you're up every 2 hours, right away in my head, I'm like, okay, so you're not sleeping well, which right away we know you're tired, you're exhausted, your immune system's affected, your white blood cells are like, oh, mayday, like the brain needs us because she's exhausted. So screw the liver today, screw the kidneys, like, we're not going to these areas. We got to send all of our army to the brain to keep her alert. And that's when you start to notice, like, the Murphy's Law thing, like when you're about to go on a vacation and then you get a tooth infection the day before. And you're
Absolutely.
Like, what the hell? It's actually because you had this infection already brewing, like the tooth was already infected. But because you're so stressed, like you're not sleeping, you're cleaning the house, you got to go buy stuff, you're up late, you're so stressed before you leave for a trip. I will never be stressed again, by the way, before I go on a trip. I'm going to be like, let's go. But anyways, so you're so stressed before a trip and you're tired, your immune system goes down and it's sending all the white blood cells to the areas that it needs. And then the body's like, essentially, I'm doing this in like layman's terms, okay? The body's like, hey, we're not going to the mouth today. Screw that tooth that's infected. We got to go to like the liver or the lungs or whatever. And that's when the infection is like, oh, we can finally beat the immune system, and it explodes. And then you get a tooth infection like on your way to Alitalia. So it's like, that's how these things happen. And that's why it's so important to know, like, oh, you just told me you're a new puppy, you're not sleeping. Like, you're exhausted. If you're inflamed anywhere, it's going to come out in the mouth too, because there's so much blood flow. So she may have not, or she or he may not have had a medical history update per
but it's
se.
that communication.
But the communication part just told me so much more. And stress is huge, that we also don't talk a lot about, but it's massive.
I bet it is. Oh my goodness. I mean, okay, so I know that, this is the thing I want people to understand. Like, you are open during COVID, okay? Because a lot of people get worried. So I want you to tell us a bit, because I've been in, and within the last month, and so my kids, because I have had so much dental work and I have to upkeep because of my acid reflux, because of my history. So I don't like missing dental appointments. So why don't you tell us how you've made changes in your office in order to keep things safe?
Well, our governing body, the Canadian Dental Hygiene Association of Ontario, set out guidelines. So I just want to do like a little disclosure. What we did here doesn't necessarily have to align with what your dental office did, because the dental college, so the RCDSO, their guidelines were a little bit different than ours. So the hygiene one came in a lot more strict per se. So that's right off the bat. It doesn't mean that your office didn't do what they were supposed to do. They did what their guidelines said they had to do. I mean, at the end of the day, they should be the same, but I'd rather be on the RCSO side, because our college is really, really So a few of the things we did was, starting off from the front door, we removed like everything in the waiting area, and I created like a triage station. So when you walk in, you get your hand sanitizer right away. We're booking like one person at a time. So if your appointment's at 1:00, the next person for the other hygienist is until like 1:15, so that we don't have traffic all at the same time. Even the staff have different start times off of like 5-10 minutes of each other, where they do a screening as well when they come in. So the patients get screened when they walk in. They get, we have oximeter readings. We do blood pressure in the waiting room now to just reduce the amount of things in the operatory. All the questions for temperature reading, stuff like that. Then you get escorted to one of the operatories. So I'm sitting in actually our third one. You can kind of see there's a glass door. And although it looks like there's a little space there, there's weather stripping to seal the room. So the rooms are all sealed in with glass sliding doors. And then we have HEPA filters in every room, where we had an HVAC specialist come in and do an assessment that with the HVAC in the building plus the HEPA filter, how long our follow time would be. So basically, like, for 10 minutes in this room means that when we're done with the patient and we close the door, we cannot re-enter for 10 minutes to allow all the aerosols to settle. So we have waiting room, all operatories have a HEPA filter. We've acquired a new donning station, which means PPE was really difficult to obtain. And I was actually at the beginning of all of this back in March, I was watching the Italian news. And then I started looking at what the dentists in Italy were doing, because Canada and Europe are very similar in their CDC and public health infection control guidelines. We wouldn't follow the state's dental procedures because they're very different. So I was following Europe, and specifically Italy at the time. And dental offices were wearing N95s. They had sealed doors. They had like air purification systems. I'm like, that's coming here. And Eric was like, don't spend money. You don't know if you need it. I'm like, I guarantee it's coming. So I started purchasing at the very beginning before we even needed it. And thank goodness I did, because now there's waiting lists for things, prices went up. But yeah, I would say the biggest expenses were acquiring fitted N95s for everyone. And that's in order to do aerosol generating procedures, which is like anything like the air water syringe. If it makes a spray, it's an aerosol generating procedure. So N95s, we got gowns. We have a contract with Canadian Linen. So we use a brand new gown for every person, even in the sterilizing room. Hair caps, that's why I look like this. But I got mine's like this kind. I kind of like it. I look like a Nuna Maria, like about to go kick tomatoes. But I got that. So we have like a full donning station that anything that we could possibly require, I've got it. And then HEPA filters, doors, a lot of policies and procedure changes. Mm-hmm. We have a new reception desk, so the two receptionists are 6 feet apart. Yeah. With like this, yeah. I even forget. Oh, we even added a change room in the break room. There's like, because now we don't come in with our scrubs on. We come in with street clothes, change into scrubs, and we leave with street clothes on. So we have a change room, in-house laundry for our scrubs, but the washable gowns which are contaminated, that goes to Canadian linen.
I mean, I have to commend you because, at the beginning it was kind of nerve-wracking. I brought my kids, but I've been there twice already since the pandemic, and I have to say I never once felt I'm not sure about this. My kid, I always felt like I was in great care. So it's kudos to you for doing that. What a great employer, because you're keeping yourself, your clients, and your staff safe. So you did a good job.
Thanks, Michelle.
Okay, so a lot of the people don't know this, but Lisa has become one of our bald members. She is married also to her job. It's a good thing. And, as an entrepreneur, I know it can be kind of not so good at times because, we become very stressed, and it's hard to break up with your job and, create boundaries. Okay. So Lisa and I have spoken about this, and even myself, even though I love fitness, it's hard to put the boundaries of when do I stop working and then start taking care of myself. So tell us, what is it like to now slowly start thinking about yourself, becoming a bald member? Tell us.
Well, I will tell you that, so I think it was January I signed up. Mm-hmm. And the first few weeks I was doing like the 5 days a week. I mean, I didn't fully do the full hour because I was like, I was going to die. But I felt so much better. And so now fast forward to month 2, I probably am doing like 1 to 2 workouts a week. Not as much as I would like to, but it's almost given me, so when I did the workouts every day, I had my days were so much more motivated. Like I started, even Eric noticed a difference. He was like, I love this, because I was up extra early, but then after the workout, you feel so good. Yeah. And I was just getting an extra load of laundry in, or like, doing a quick vacuum in the morning. I don't do that normally. Like my mornings, I get up, breakfast, coffee, get the kid out, let's go to work. Like I don't wake up at 5 a.m. for fun. And I wish I was like that, but I'm not. So like people say like entrepreneurs, like they get up. No, like I'm the opposite. I'm like, I could stay up till 3 o'clock in the morning, but morning is not cool. And I noticed a difference. And then what's interesting with you, Michelle, is I see your posts all the time. And like, I think it was even this morning, you posted one about changing your words. Like, I have to do this. Yeah. And it's so interesting because I see a therapist weekly. Originally, side note, guys, I had a really bad concussion like 3 years ago and an injury. So that's why I started seeing the psychologist to work through this concussion. And I've maintained seeing this person weekly because it's so important. And if the silver lining of my accident was, you don't realize everything matters, like our mentality, how like everything. And now that, here I'm talking about like dental, so it's all relative, everything, exercise, your thoughts, everything. So I think for me at this stage right now, my goal starting this with Valp was weight loss, right? Like I'm entertaining having another child. I've had some injuries. I want to feel better. I want to exercise. That's how it started. But in the last 2 months, I'm working out 1 to 2 days a week, but I've been drinking way more water than I ever did. So like that has maintained. Or the thought process, I think I had to do things in a different order. So it's like, yes, I want to exercise more, but what I'm taking from you, Michelle, is that positivity. Like, I don't need to be so hard on myself. Like, I don't have to do this. I should do it. But even that wording is not positive, right? So for me right now with Be Active, Live Better, I think what I've noticed the most that I find like probably the most positive for someone like me is like one day at a time, you know, like small wins, like small gains, like, yeah, you drink your water. I'm still watching what I'm eating. Yeah. Just not exercising as much, but I think it was the positivity, the mentality. So it's like, I don't have to do all of this like today. I need to be more positive and encourage myself. Like, yeah, Lisa, like you did do a lot today. Like you ran a business, you handled all these questions, you dealt with customer service. I cooked food for my family. I drank all my water. Like there was a lot I did today. I didn't get that workout in. I want to, and it's still on my mind. It's like I almost feel guilty not doing it. But there's other things like I will say, like there's times like you posted a chair routine. And for me, I have the physiotherapist I see twice a week. They gave me similar chair routines. And I saw it and I'm like, it's like this chair routine is stalking me, but it's reinforcement. Yeah. And it's interesting how you are so in line with what the physiotherapist is providing to me and what the psychologist is providing to me in terms of boundaries and words, affirmations. And then Michelle's like popping up on your newsfeed and she's reminding me of the exact same things that these professionals are also telling me. So it's kind of like, I don't even know if I told you that, but it's like everyone's kind of working. It's a interesting circle how it's coming around. It's like all these healthcare practitioners that I'm seeing for something unrelated to weight loss is still intertwined with the person that I was seeing for weight loss. And Absolutely. It's all relative.
And you hit it on the nail because just like you said, you know, in dental, you need to work closely with the dentist and healthcare and doctors, right? And the same thing, if you find a fitness professional that's only one track where it's like they only think about weight and, you know, they're going to do everything in their power to make lose the weight. I'm not sure, you know, I've never been aligned with that approach. My approach is all about mind, body, and spirit. They have to be interconnected with each other in order for us to live better. The whole point of Be Active, Live Better is activity will help you live better, but changing your mindset, just how you said, you know, I'm proud of you because, you know, you are busy in itself. And I keep telling you, and even like, you know, not in this interview, you know I'm proud of you. You know I'm always going to be in your corner. Okay? So it doesn't matter if you are working out, as long as you say those words where I feel good about myself, then I've done my job. And that's what it is. It's this is not about, I'm going to lose all the weight in the world, because when people come to me for that, they'll soon realize that I'm not about that. It's going to come because it's a natural effect of taking anything, you know, but as soon as you said those words, that's exactly what it's about. It's about being positive. And guess what, girl? You are now.
I've been pretty positive lately. Like, I'm always positive, but I think it's like one of those like I literally, if I was a cartoon, I feel like it would be me with like, you know, like la 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 la, and then there's just dark and gray behind me, buildings crashing, and like in front of me, it's all bunnies and rainbows and shit's just going down behind me, and like it's so hard. But I've never exercised and then later said, oh, I wish I didn't do that workout. It's like so motivating, but yeah, it's just crazy. But I think, I mean, I'm full of excuses too. So you've been helping me with that too.
Hey, listen, it's like you said, it's one day at a time. People need to understand this. It's not, I'm going to tackle the world in, you know, one day. It's just chip away at it. It's the action of trying. It's not the action of completion. It's the action, I'm going to get up, and today's going to be a trying day. It's not going to be, you know, it doesn't have to be a great day, but I'm going to try. As long as you give trying a shot, then you're going to be successful. Okay, so I want to talk about, like, really quickly. So someone wants to try your office, because I want people to know that you are open. We talked about you're making it safe. What is the best way in order for them to make an appointment with you?
They can go to our website, dentalhygieneofniagara.com. And they can, check us out first. Like there's the list of all the people that work here. There's the forms on there that you can fill out and send in, or you can just even send a question we can answer. The Facebook Messenger app, like for Dental Hygiene of Niagara, we check that daily as well. Email, dhniagara@gmail.com, or you can even, a lot of people just go on my personal Instagram or Facebook page and they just direct message me. And I was like, yeah. And I was like, give me your number. I'll get the receptionist to call you. Or I just kind of talk to them. They're like, here's our office number, call. Sometimes I can do it too. It's just some days are not as boring for me as others.
The best way is to go
wherever it says Dental Hygiene of Niagara and it says here, like someone will get the message or call or anything.
Okay, before we go, I want to know, what is something that we should be doing every single day in between cleanings, or maybe people are not ready yet to get a cleaning, but what is something that we should be doing like in a routine that's going to help us keep our mouths clean?
I would say number one is brushing your teeth, because some of us may think that is routine and normal, but it's actually very common for people not to brush their teeth every day. They'll brush like 3 times a week, 4 times a week. So brushing for sure, because you need something mechanical to physically remove the plaque biofilm. I don't stress a lot of flossing. Flossing is important, but it depends on the person. Like if you have huge spaces in between your teeth, I'm not going to sit there and be like, you need to floss more, because flossing isn't going to do that much. Like that's when there's different intradental aids that we would recommend. So it's more client specific. So I would say for sure is toothbrushing, and definitely another one, because tooth decay is so prevalent. We don't have fluoridated water in Niagara, in case anyone's curious. I would definitely say water. Drink more water, less liquid sugar. Pop is a beast for our teeth. It's bad. And like liquid sugars, juices.
How about carbonated water?
Carbonated water. I was actually reading like an article, like a peer review. Whenever you're reading articles, just make sure it's peer reviewed. But no, there's no acidity. There's no sugar in it, but you should read the side. Depends which one too, right? Like some of them might have like sodium, sugar. Like the bubbly has 0 down the board.
Okay.
I mean, I hope like it shows 0 sugar. I kill the bubbly. It's the only way I can drink a lot of water.
Okay. All right.
I love it.
Okay.
But yeah, water in general. And even for our gums. Another thing is because of COVID, so a lot of people are wearing masks now. More often. And it's really important to notice this, to mention this, but when we wear a mask, naturally we start mouth breathing, right? Because if you breathe in through your nose, on a normal day without COVID, we didn't breathe. As humans, we don't actually breathe properly. Like, that's how we should breathe. But we don't. We stop breathing. We breathe through our mouth, whatever. You add a mask, we're now breathing through the mouth even more, which causes dry mouth. It makes reduced saliva, dry mouth, which introduces an increase of cavities, because saliva is our body's natural way of cleaning the mouth. It's got a neutral pH balance. So when we're very acidic, so if you're mouth breathing and you have acid reflux, it's a recipe for disaster, because there's the acidity. So you have acidic pH balance in the mouth, plus your mouth breathing, so it's dry. So your saliva has no chance to help you. So now you've increased not only cavities, but gum disease. Wow. And even like with sleep apnea. I think we just got off topic there, in case anyone wanted to know.
Wow.
I am medicated for ADHD. But sleep apnea, like, another thing when we're checking throat cancer, when I get you to say, I'm looking at your uvula, the hangy ball thing. The uvula, when it's supposed to be like short and like blunted, like a polyp. Okay. When it's elongated like an icicle, that is a clinical sign of snoring. Because when you're snoring, your uvula is vibrating. So constant vibrations causes it to stretch out. Wow. And that's usually a sign that you're snoring at night. So then I'll be like, oh, do you know if you snore at night? Do you feel rested when you wake up in the morning? And if you start answering yes to these questions, like you might need a sleep test. So like that could be another weight gain. Aside from it's not even teeth related. At that point, it's your brain needs to rest.
Mm-hmm.
So if you're trying all these things and you can't lose weight, it's probably because you're exhausted and your endocrine system's affected. And women's health, like hormones, it's all because your elongated uvula is like, help me, I'm so ready to sleep.
Okay, so this is it, people. You need to get your teeth and your mouth checked. It's not just teeth. You need to be comprehensive in your health preventative care, okay? So listen, if you do not have a hygienist or you're not seeing one right now, please reach out to Lisa and her team. I guarantee you, you're going to leave that office with clean teeth and your belly's gonna be hurting because you're laughing so much that you're gonna be like, oh my gosh, like this is the best experience ever. Okay, so if you need that, Lisa is here. I'm gonna post all her information up as well. And I want to thank you, Lisa, for chatting with me today. It's always a good time chatting
Michelle.
with you.
I'm sorry I talk too much.
Yeah, we could probably chat for hours, but we're gonna end it now. And again, if you want to reach out to Lisa, Dental Hygiene of Niagara, located in St. Catharines, I'm gonna post all information. And thank you so much for tuning in. We'll see you next time. Ciao.